Year after year, rhinoplasty remains one of the most popular cosmetic procedures. But can you get a similar result without surgery? Dr. Orton is in our procedure room right now putting to the test a treatment that claims to instantly lift the tip of the nose. Dr. O?
Yes, sir. We love our rhinoplasty, and joining us today is facial plastic surgeon and rhinoplasty expert, Dr. Deepak Dugar, and he's going to demonstrate on the lovely Patricia his injection rhinoplasty. Now, Doc, 2 steps, correct?
Yes, Botox and fillers. Botox we did 6 days ago, so the effect is kicked in, and now we're going to do it with the fillers. So we're going to use the filler to lift the tip of the nose. So I'm going to have you go ahead and lean back.
And before you go on,
Yes.
explain to us what you've achieved with the Botox. You're blocking certain
Yes.
muscles, right?
Exactly.
We use it for wrinkles, but what are you trying to achieve
So
here?
typically we use Botox for wrinkles, but with her, there's a muscle underneath the nose called the depressor nasi, which we love to weaken just a little bit so that when she's smiling, it doesn't pull down as much. I actually have the same problem in my nose, and so it's my personal need, or it came
If
from.
you have extra Botox, I can take care of that later. But you know, to understand that if you have a nose that's pulling down, if you block this and you bolster this area, you see how that tip will come up, and in the process, if you have a small bump, that bump disappears as you raise that tip.
That's right, that's right. So we're gonna put a little filler at the bottom to lift it up, and we will start right now.
Take it away, Doc.
All right, go ahead and lay back for me, and we'll begin.
So, Dr. Dugar, what makes her a particularly good candidate for this procedure?
So she's a great candidate because honestly, she has a beautiful nose and shape, but she just needs a little bit of support at the base of her nose. This area right between the medial crura is just a little under supported. So what we do is we like to lift it and give her just a little bit of extra support, almost the same technique we would do during surgery where we place what's called plumping grafts sometimes to lift the tip of the nose.
So it's sort of a 1-2 where you're using the Botox to sort of untether and then the filler to give it a strut or to prop it up?
That's exactly the right way to think about it. You're using the filler just to give it a strut, and you're able to lift it up just a little bit.
I see that coming up already.
And we're gonna do a T technique where we do a little bit from the side and a little bit from the front.
As with all fillers, how long would this result last?
So typically with this type of filler, we're gonna last about 1 to 2 years. Depends on the type of filler used, but the thicker types will last you about 1 to 2 years.
How much would the cost of a procedure like this compare to surgery?
So typically this type of procedure would cost somewhere around $1,000, but surgery could cost anywhere from $10,000 to $20,000. So significant savings.
Now explain what you're doing, that you're doing some plumping, you're raising above and below her hump
yes.
to straighten her profile.
Exactly. So part of the lifting of the tip, the effect is also to smoothen out the profile. And we do that by putting a little bit of filler above and below the bump so that it makes the tip of the nose look lifted and the profile look smooth. And by doing both, you get the best effect and you achieve the highest result.
So guys, before we go, if you had this procedure done, you liked the result, say a year or 2 passes, and you say, I want this permanently,